I inherited a very aggressive degenerative arthritis. I had a double hip replacement at 47. My doctor told me that I would be in a walker in 6 months, in a wheelchair in a year, and eventually, I just wouldn't be able to walk anymore. I was in extreme pain, and I thought that was the answer. And then I was at a concert, and I fell down a flight of stairs. I fell down on both kneecaps. I didn't realize that I had injured myself, tore the meniscus and the ACL in my right knee, and at the same time I dislodged a piece of cartilage that got stuck in the joint. So I had extreme pain, incredible swelling. My knee was probably 7 times its size. I had water in the knee. The doctor said, let's try some non-invasive things. So we did cortisone, and then we did, I forget the name of it, I call it WD-40 for the knee, where they inject this jelly kind of stuff into your knee, and it's supposed to act kind of as cartilage. It didn't work for me. So I was immediately on painkillers, anti-inflammatories, and then narcotics. The pain was so bad I couldn't walk, I couldn't go to work, I live in a townhome, and there are 39 steps from my garage to my bedroom. So it was the worst possible situation in terms of functionality, and I was in terrible pain. And finally, I did arthroscopic surgery, but because of my age, they didn't have a lot of high expectations. Your knee doesn't heal well as you get older. So I waited about 12 weeks. I was on heavy narcotics, iced my leg every day, absolutely reduced work schedule. Their only solution was physical therapy and narcotics. There was nothing else that they could do for me. The doctor basically told me that I needed to replace both knees. My right knee needed to be done right away, and eventually I'd have to replace my left knee. And between the pain and the narcotics, which is the only thing they offered me, was physical therapy and narcotics. And every time I would complain about the pain, well, let's give you more medication. They totally didn't get it. And it was like, can't you put a salve on my knee? It's my knee that hurts, not my head. And the narcotic, it's poison. It's absolute poison. It was affecting every aspect of my life, affecting my ability to work, at home. It's just awful. And I was desperate. And I was literally, when I came to see Kathy, I was 2 weeks away from going to Costa Rica to have a knee replacement. I couldn't afford the surgery. I was uninsurable because it was a pre-existing condition, and it was a $120,000 surgery here in the US, and I could get it done for $32,000 in Costa Rica. It was at that point where I met a patient of Dr. Warren's, Cindy Power. I consider her a dear friend, and we met in a business environment, and she said, I think you need to come and see Kathy, and I think this quantum neurology will really help you. I did some research. Although I have an open mind, I was a little skeptical about it. She asked me if I wanted to come to a treatment, and at first I was really skeptical, and I put her off, and I'm like, I don't know about this whole holistic thing. But it made sense to me that clearly Western medicine was not working for me. I was at the end of my rope. Couldn't deal with the pain anymore. The narcotics were destroying my life. It wasn't helping my pain, and nobody would help me. And I saw, not only did I see what it was doing for Cindy, but I saw the potential in terms of opening my mind to an alternative form of treatment. And I felt results immediately. After 2 treatments with Kathy, my knee, the swelling was gone. I started to, I was focusing on my diet. I'm on day 14 of a 21-day cleanse. I feel amazing. I've never felt so good in my life. So I have a clarity of mind, kind of a balance of energy. I'm sleeping better. I sleep earlier. I sleep longer. I don't wake up as often. It's truly been incredible. So I see Kathy, it's not just you come here for a chronic pain of some injury or something, but she's like been a life coach to me. I've stopped taking the cholesterol medication, and pain medication stopped as soon as I started seeing her. And I'm also, now that as soon as I'm done with this cleanse, I'm going to go back to my doctor, do my blood work, because I want to get off my blood pressure medications as well. So I really see her as much more than somebody that treats a specific illness. She's really treats the whole body and the whole mind. So I'll be a patient here for a long time. I just can't recommend her enough. And I tell everybody that'll listen to me.